back. Well, the demand for regional mental health services has spiked since the pandemic, forcing many psychologists to close their books because they can't keep up. According to the National Regional Check-In, a report commissioned by the Australian Counselling Association, 68% of those living in rural and regional Australia experienced depression and anxiety over the past 2 years. It's been described as a ticking time bomb. Philip Armstrong is a CEO of the Australian Counselling Association and he joins me now live. Philip, appreciate your time. We know the mental toll has had a huge impact on people nationwide throughout the pandemic, but are you surprised by this data when it comes to what's happening in regional and rural areas?
Good evening. Thank you for allowing me onto the program. Unfortunately, we're not surprised. We warned the government in 2019 that this was coming and that they needed to start increasing mental health services into the rural and regional areas. But I am surprised at how much the need has risen. We knew it was in crisis in 2019, but now it's beyond crisis.
I've got to say, some of the statistics, the data, it makes for a harrowing read, particularly 41% of people in the regions did not seek or could not access the help that they needed. That key word there being could not access. Why is that?
Several factors. I mean, the simple fact is that 75% of Medicare rebatable services are delivered by professionals in the inner city suburbs of Melbourne, Brisbane and Sydney. So that only leaves 25% to service the rest of Australia. So obviously you're going to have a workforce shortage. But also for those who even have services that may be available, there is waiting lists, significant waiting lists, up to 6 to 8 weeks in some areas. That also becomes an issue. But even then, again, then you have another hurdle. You've got gap fees. If you can't afford those gap payments, well, then again, you can't access the services. Now, this is supposed to be a Medicare rebatable service, but the reality is for a lot of people, particularly now, those gap fees are just too large.
You mentioned some people are waiting 4 to 6 weeks just to see a psychologist in the regions. Are regional counsellors, are they struggling to keep up with demand?
No, this is the irony. The regional counsellors are sitting on their fingers waiting for the government to put them into the Medicare system so they can start delivering services themselves. In many of these areas, in rural regional areas where there's not even a psychologist to be found, we've done a mapping exercise through postcodes. There are counsellors in those areas, counsellors and psychotherapists, who are university trained, well qualified, very experienced, who could be delivering an equivalent service to these people, but they can't offer them Medicare rebatable services.
Do you think that there's been a lesser focus on mental health in the regions compared to city areas?
Absolutely. When it comes to the division of service provision, absolutely. The inner city suburbs are very, very well serviced. But again, without being critical, the majority of the service providers are in generally affluent areas. So even if you're in a low socioeconomic area in a city, you're going to be experiencing very much the same as people in rural and regional Australia.
What's the solution here, Philip, do you think?
Well, we have a solution for the government. We could put 3,000 to 4,000 qualified, registered counsellors and psychotherapists in the field tomorrow if the government would simply put them against the Medicare system to allow us to deliver rebatable services. And we've surveyed our members, and over 60% of our members have responded saying that they would actually bulk bill. So we'd even help to alleviate those gap fees. The other issue is that a lot of the counsellors and psychotherapists are actually in rural and regional areas, and they are locals. So, they understand the issues that are on the ground in those regional areas. Because as we know, each region is unique, and you really need to understand what's happening in that region if you want to help people within those regions.
Yeah, absolutely. Well, they're shocking statistics, but certainly ones that need to be presented nationally. Philip Armstrong, thank you very much for joining us this evening. And if you or anyone you know is feeling distressed, you can call Lifeline on 13 11 14 or visit lifeline.org.au for more support.